recording, and I'll begin. Thank you so much, everyone, for being here to the RX Marin and the SPAR Center Substance Use Workshop. This session is being recorded and will be available on our website within 24 hours. We're also having this webinar translated simultaneously into Spanish. I will say this now in Spanish. Hola y bienvenido al uso de sustancias del equipo juvenil opioides RX Marin y del SPAR Center. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Gracias, muchas gracias a Marta, que es nuestra intérprete esta tarde. So it looks like one of our students, Zach, was planning to be here, but I don't see him on here quite yet. So I'll go ahead and make the introduction to Nancy Vernon of RxSafe Marin. Nancy, we are so thrilled to have you and your expertise and your team here. Thank you very, very much and welcome.
Well, thank you. And we're excited about presenting today. We're going to focus on treatment options and approaches, and then we're going to also talk about school resources and hear from a parent who has experiences with a child in treatment, as well as someone who's been in treatment themselves. And for the sake of time, I'm going to let every presenter introduce themselves quickly before they present. But a big thanks to Jeff, Judy, Rachel, Jen, Jessica, Donna, and Dom, and I don't think I left anybody out. So thank you. And we will be monitoring time just to make sure, since we have a lot of presenters, that we get through everything. So I just wanted you to know that if we break in. So thank you. So take it away, Jeff. And I think Michelle, he'll probably want to share his screen. So if you can allow for that, we'll get started.
Everyone has access to share screen.
Great. Thank you.
All right. Terrific. So when I did that, everything changed on me here. Okay, great. So I feel like it's like a family dinner where many of us know one another, and I'm going to give you my, at the risk of some things being repeated from other times that I've talked, I'm going to give the family the talk again, but I just want to verify, can I get a thumbs up that you're seeing a graph on the screen? Okay. I can go a number of different directions here, and I know, Nancy, you and I had talked about this, and, just as a general framework, I'm going to start with some information about, that look at sort of some of the unique aspects sort of demographically around youth and adolescence and substance use, and then kind of move into some, I know I've got 10 minutes, but then move into a little bit about sort of biological things that might be different between youth and adults that might pertain to substance use. And, if I have any time after that, I'll just keep rambling. So the first thing to highlight here is just, this is a somewhat complicated graph, but I kind of wrestled with whether to present this one or not, but then when I finally kind of understood it, I was kind of happy that I understood it, so I figured I would present it and see if I could make others understand it. The bottom line with this graph is just showing that as a percentage of the population in a particular age group, as a percentage of that population, what is the burden of sort of drug use disorders in that population? And as you can see from this, not surprisingly, the peak prevalence in terms of percentage of the total population that has a substance use in that age bracket, we see the 15 to 25-year-olds as kind of being that's the highest percentage group across the board. I mean, I don't know if they're going to 70 plus. I don't know if they, factor out like the 110-year-olds. But frankly, if you've gotten to a 110-year-old, you can do whatever you want in my book. But the the idea here being that there's a high percentage of people within this young age group that has substance use disorders. So again, When we look at opioids specifically across the map, now this is data up through 2018. I can tell you that the 2019 data is a little bit disheartening. I just didn't get it into this graph from the standpoint that where we see those decreases in the 18 to 25-year-olds from 2017 to 2018, we actually see that go up in 2019 again, not higher than 2017, but still, it's not a trend down, unfortunately. But what you can see, and the thing that I wanted to kind of highlight from this is past year heroin use disorder. So this is just looking at heroin, not looking at other opioids. And what this is showing is that peak sort of there in the 18 to 20, again, we're back into this 18 to 25-year-old range where there seems to be disproportionate impact on that age group relative to other age groups. It should come as then no shock then if we've got a disproportionately high number and percentage of the total population that's misusing opioids in this population, in this age group, that we would see that they would also have higher, or they would have high overdose death rates. And that's what this slide is showing. And that the rates of opioid overdose deaths in teens tripled from 1999 to 2016. And you can see this in this graph in sort of relation to other substances like the benzos, the cocaine and other psychostimulants. And again, this is only up through like 2015, 2016. But there haven't been significant major changes, moving forward in the data. So what are the unique, or what things might be unique about adolescence drugs and the risk of developing a substance use disorder? Well, for starters, we know that developmentally and biologically, adolescents are at greater risk of, number one, initiating substance use, number two, progressing from occasional use to an actual full-blown substance use disorder, and three, short and long-term harms of substance use disorders. So if they develop a substance use disorder, they're disproportionately likely to develop problems or have harms as a result of it than their matched age cohorts in different age brackets. So why do I put this up here? Because I think it's an interesting tie-in to thinking about what biologically, that there might actually be a biological reason that there are these differences between adolescents and perhaps adult cohorts. The real sort of, and I took out a lot of fancy graphs in this that I didn't understand, because I have to give credit to a colleague of mine, Emily Tajani, who has spoken at a number of things locally as well. She's a child and adolescent psychiatrist who's also an addiction specialist, and just absolutely wonderful. And she lent me some of this data. What this slide is essentially showing, and what I kind of want to highlight with this, is that there's a mismatch in development of the brain between different regions of the brain and how quickly and when they develop or achieve maturity. So it's sort of, you can blame whoever you want for this in terms of like, is this, something that evolution kind of put in place? Is this something that was evolutionarily advantageous at a certain point? We can speculate about this, but the bottom line is that what we see is that we see that the parts of the brain that regulate the experience of sort of reward and impulse, those develop faster than the parts of the brain that are charged with dealing with sort of a higher executive function. So weighing the pros and cons, decision making, executive function is what we would call it, but it's, as if we were in person, you'd see it better. I kind of bonked the front of my head. It's here. It's the sort of frontal lobes of your brain. Those develop actually and achieve maturity slower than those other sort of reptilian impulse parts of your brain. Now, some people have hypothesized that the evolutionary advantage of this is that as a population, you need to have some risk taking early in order to achieve, mating predominance or whatever it might be. And then later you develop the executive function in order to kind of then, make higher level organizational decisions and things like that as part of a society. I don't know. I'm not an evolutionary biologist, but I know that that this is a mismatch that I think plays out biologically, or provides some evidence for why we see some differences between youth and adults, from the standpoint that their impulse parts of their brain are cooking and are fully mature and ready to go, and that decision making, weighing the pros and cons, sort of executive function part of the brain still hasn't achieved full maturity yet. So we see this mismatch. And that can leave people in this age range more likely to take risks with things like substances, more likely to do things during that age group or during that time of development that adults may not in the same way. And that some people, that might create a vulnerability for the development of full-blown substance use disorder and additional harms. And I think most people would say that, you know, that they have some experience with seeing how this plays out in real life with kids. That that there are 1,000 phrases about kids' decision making. You know, when I say kids, I mean youth decision making relative to adult decision making, and that it's clear that there's some differences in sort of how decisions are calculated between younger people and older people. Okay, so into then thinking about treatment, um, medications for addiction treatment. Okay, so there on this is sort of a whole slew of different things with some randomized control trial data and whatnot. But suffice it to say that when it comes to treating younger people with medications for addiction treatment, the party line is, listen, if someone has an opioid use disorder, if someone is full on using, you know, opioids in a risky pattern, they're a candidate for medications for addiction treatment, whether they are 13 or whether they're 35 or 135. So what does this mean? This means buprenorphine or Suboxone. This means in all of its different formulations, methadone and naltrexone. Buprenorphine and methadone are both opioids themselves. And the goal with them is to basically take someone out of that cycle of using intermittently and having withdrawal, or using intermittently in a risky pattern, and put them on one medication that they can take once a day that will last about 24 hours and will take them out of that cycle of risky use. We know that it works, and there's plenty of trials to show that. Unfortunately, the FDA hasn't approved buprenorphine for people less than 16. However, I can say that in talking with my colleagues that work with individuals who are under 16, they absolutely prescribe buprenorphine for people under 16. It's just, I always have to make that caveat that the FDA at least says, you know, we're not approving this for people under 16. Then again, the FDA also doesn't approve almost anything for anybody under 16. So it's not like that's unusual. Just some benefits. If you have a youth that has opioid use disorder and you start a medication for addiction treatment, statistically, this has significant positive impacts in their life when we look at sort of big cohorts when this has been studied. Here are some big ones that are pretty important to youth and to families and to society at large. So a 70% reduction in overdose deaths. And again, that's from, you know, extrapolated from adult data, but nonetheless, we see MAT, medications for addiction treatment, decrease mortality in people that are misusing or using opioids. It can decrease the risk of HCV and HIV risk in youth, and it can reduce the possibility that someone may progress from occasional oral or insufflated, you know, or inhaled or smoked opioid use. It can decrease the likelihood that they'll progress to IV use, which of course has its benefits. This is, you know, also kind of a graph that I'm not going to expect folks here at 4 o'clock, you know, necessarily to kind of digest all of, but the bullet point is this, which is that youth, despite this, youth are also less likely to get medications for addiction treatment. I know I'm over time. I'm looking at my stopwatch that I did here. I'll just add quickly here at the end, and these are, you know, again, kind of the tail end of my slides anyway. And if the family wants to talk more about about any of these things, I'm happy to. This was an interesting study that looked at sort of reasons why youth might decide, and this is sort of early adolescence, that's what EAs are, and adolescence, sort of what the reasons why they might choose to quit or decrease their use of substances might be. This was surprising to me because I think that what most of us think is the next slide, which is that we try this idea, I'll give you, I'll give you all the video games you want if you just stop using heroin, right? That actually was surprisingly less of a factor in decision making for early adolescents and adolescents who are deciding to stop using or decreasing their use than things that were actually much more internal and sort of internal strength based, like 79% of adolescents saying that one of the reasons that they would decide to quit would be that they want to show themselves they could quit if they really wanted to. So again, that kind of highlighting some of maybe the misconceptions we also have about what motivates people at different age groups, that younger people are motivated by perhaps different factors than we might assume. Those video games might not be actually as motivating as we assume they might be. um, Last thing to just mention here is what do we do in treatment? Well, in treatment, we try to target those things that we think might, with youth in particular, that we might think there might be some deficits or there might be some areas where some maturity needs to be developed into the thinking processes. So we would try to work on specifically improving the prefrontal cortex functioning. In therapy, we would work on kind of thinking about how can we kind of improve the actual, get that front part of your brain to be calculating decisions more effectively in favor of what your personal goals are. Secondly, kind of reducing the reward pathway, and the associations between drugs and reward. So try to make sure that we're fostering activities that also provide rewards but don't involve drugs. Kind of a big thing with kids and a big thing with adults too. My last comment here is that what we find is, and I often say this with patients that I'm treating, is like right out of the gates, I say, what we are aiming to do is we are trying to realign your life in such a way that there are things that you want to do more than what you're currently doing. And that's the ultimate goal. And that's, and other people will speak to sort of the concept of recovery, but to me, that kind of sums it up, and I try to kind of lay that out on the table. And my colleagues who work with children and adolescents also echo that as well. So with that, I know I'm over time. I'm sorry to have taken extra, and I will stop sharing my screen and hand it back to whoever wants it.
Thank you, Jeff. And I think thank you very much. It's incredibly informative. And I think Rachel has a deadline. So Judy, if it's okay with you, we're going to have Rachel go before from Shoreline Unified to talk about how they might handle or what their process is in assisting a youth with substance use issues. And then we'll go to Judy, if that works.
Yeah, that's fine. Thank you. Hi, I'm Rachel Kobe. I am the school counselor at Tamales High School over there in West Marin. We only have about 164 students, and we definitely have a unique population being in the more rural West Marin area. So a little history on kind of what we've done. I mean, we're definitely small, so our resources are limited, but I think over the last few years, we've definitely expanded our program and the resources that we have. A few years ago, I think about 3 years ago, we started a partnership, 3 or 4 years ago, sorry, with SAY, Social Advocates for Youth, through Santa Rosa. It was an alumni who was interested in coming to provide some services that worked there. And she was a licensed drug and alcohol counselor. So they had kind of, with the principal, they had started kind of a suspension diversion program. So if a student was caught using drugs or alcohol on campus, instead of having them be suspended or in-house suspension, they were offered 3 sessions with the SAY counselor to do some drug and alcohol counseling on campus, to then kind of help rehabilitate within the school versus sending them away and doing a regular suspension. So she worked with us only 1 day a week, but for our relative size, that worked out pretty well. And she also would do presentations on prevention and education for students and for parents, as well as we had kind of partnered with Huckleberries to do some education as well for students. This last year for 2020, 2021, we transitioned to kind of broadening our partnership with Coastal Health Alliance that we have. And since our SAY counselor was already moving on, it was kind of perfect timing. So now we have a social worker who's on campus, or on campus since we're not really fully on campus yet. She works with us 3 days a week. And so, you know, we haven't obviously had too much this year where we've had incidents on campus. But she's been supporting us with mental health, as well as kind of continuing. Our plan is to have her continue that suspension diversion program and have that as an option for students if they are
I think that's Kelly. I'm not sure what's going on there.
So she's kind of continuing where SAY left off with some of that. She's also be able to mute.
Michelle,
I
if
think
you're the
there's-
host, you can actually
I'm
mute.
I'm trying to
okay.
mute. Thanks. Sorry. There we, nope, I don't want to mute Marta.
I think you're good.
Yeah.
So sorry, I'll just say that again. Our Coastal Health Alliance social worker is kind of continuing where our SAY counselor left off. And then she's also a part of the TUPE program through MCOE, and she's working on rolling that out with some of our students in the next month or so. And so that's something we're looking forward to doing for more prevention and education over the next few years. And so I think with getting somebody on campus a couple more days a week, we're working on, you know, more wraparound services and supports. And ideally, and hopefully within the next 5 or so years, we've definitely talked about doing some sort of wellness center. So we're just trying to figure out the logistics of starting that and figuring that all out. So that's something that's definitely, hopefully, something we can do in the future, because I think definitely out in West Marin, it would be great to have some services local to the school, especially since our district is so wide, and other health and mental health services are hard to come by for some students because they're so far away. So I know that's a big goal of ours, is to try and get things more centralized to the school and have access to things on campus. So students have more resources kind of right there in their back door when they're at campus. So that's a little bit about Shoreline. Anything else you wanted me to cover, Nancy?
Well, great, Judy. No, Rachel, appreciate it. Thank you very much. Thank you very much. And we met your deadline, so thank you. So now we'll hear from Judy in Summerfell City Schools.
Awesome. I'm going to share my screen quickly. Just let me, here we go, present, and then share my screen. Great. Oop, where'd our pictures go? Sorry, give me 1 second. Okay, so our pictures should have popped up, but I just wanted to show quickly. Oh, actually, before I start, my counterpart at TL, who's our clinical supervisor, Nicole Jansen, is also here with us today. So Nicole, please feel free to jump in whenever you'd like to. So I'm going to skip this slide since for some reason my pictures are not downloading here. Ooh, there we go. So this is our team over at the 3 high schools, San Rafael High School, Terralinda High School, and Madrone. What is the role of San Rafael City School mental health providers? So we provide direct services, individual, family consultation, and group sessions to our students, consultation to faculty and staff as needed. We coordinate a student's re-entry to campus following a mental health crisis, provide preventative outreach to enrich the school community and to help reduce stigma associated with mental health support. So what that looks like is Suicide Prevention Week, also making sure we have some activities, mental health related, in terms of decreasing anxiety or stress during finals week, midterms, also supporting our students with referrals to CBOs if appropriate. So this is where I'll touch a little bit more in terms of substance abuse. This is where that comes in. Also crisis counseling, if appropriate and if staff is available. And then what is the scope of school-based counseling services? So generally a block of 8 to 10 sessions lasting 30 to 45 minutes long. It's voluntary. Family sessions in support of educational needs may be provided. Brainstorming, problem solving, identifying goals, working towards solutions, providing validation, conducting reality checks, and lastly, processing trauma. So death, significant loss, extreme fears, abuse, reunification, acculturation issues that some of our newcomer monolingual Spanish speaking students may be encountering. And in terms of community-based partnerships, we are partnered with Huckleberry Youth Programs for our reproductive sex ed classes in our 9th grade health classes. Partnered also with HYP for newcomer groups for our monolingual Spanish-speaking students. And we're partnered with community organizations such as Huckleberry, BACR, et cetera, for substance abuse, brief intervention, counseling support. If a student is under the influence on campus, we do refer our students to a peer solutions. It depends on the students, and it depends also on the gravity of the situation. But we do have peer solutions team, which is our peer court, youth court, that we're partnered with as well, where students co-create a restorative contract with their peers and adult facilitator. So that may look like jury services, where it's a jury of their peers, and they may also participate in jury services for other students that potentially could be going through peer court as well. Community service and a restorative project. There's also a 12-hour substance abuse what is it? I'm sorry, I'm losing my train of thought. A 12-hour substance abuse training that they could potentially participate in. And parent involvement is also within this training, where they learn about reducing their use and potentially seeking out support in terms of counseling, in terms of participating in other activities on campus. And this is something that's offered to our students as well. I believe this is the last slide I have. I'm not sure if, Nicole, was there anything else that we wanted to touch on or that you felt was important for us to mention in terms of our substance abuse on campus?
I think you covered it. We could always do more. I think that's the overarching spirit, is that we have some things in place, but I think in the going on 8 years that I've been with the district, you know, we have a lot of mental health related needs competing, and substance abuse is there. We all know it's there, but I think it's taken a little bit of a back seat to some other things. And now I'm hearing much more about it this year. So I'm very glad about that. And I'm looking forward to seeing kind of what that rolls out to be. But I think, Judy, you covered it. Thanks.
Mm-hmm. Thanks, everyone.
Thank you, guys. Really appreciate it. So now we're going to move on to Jen, who's with Novato Unified.
Well, hello, everyone. Thank you for having me. It's my first time here, so I'm not the face of this typically. So I'm going to do my best to give it justice, but Katie is unable to be here this afternoon. Really, I think the main focus that we've seen over the last couple of years is the development of our restorative justice and restorative practices program, and how that's been supporting, but also kind of melding together with our TUPE program. As of this year, we have 3 full-time restorative practice specialists, each serving our high school and middle school populations. And then we do have a TUPE coordinator on each one of our campuses, so that we have a point person in all those places to help coordinate services. I think another key shift that we've been working towards is really our mindset around how we initiate services when a student is using, or a student is suffering from addiction. And so the first is around just our board policies and our practices around discipline, that it's not a discipline, it's not punishment, that we really are looking this as how are we rehabilitating, how are we providing support, and making sure that we have internal supports, but also partnerships within the community that have higher levels of expertise than perhaps on our campuses, to make sure that our students, specifically our students using opioids, are supported. So we've got a strong collaboration with the probation department, but also with North Marin Community Services, supporting addiction. We certainly, like you've heard, have a lot of room for growth, and we certainly need, could use a great deal more support around addiction counseling. But we've also passed several board policies specific to our practices in handling students who are on campus or who are reporting usage or addiction. And so that's been great. I think also in partnership with our community-based organization is finding spaces on our campuses so that students can be served on campus. I think a great model of this has been at Novato High School, where we've opened up a wellness, we're calling it a wellness campus, but they actually have a wellness center. And that allows us to be more flexible and where and how our students can access services and be served, so that they're not navigating outside of their regular school day. And with that, there's a lot more, but that is what I wanted to share on behalf of Katie. And so I appreciate just your time, and I'm really a learner right now in this environment. So thank you so much.
Thank you. Thank you, Jen, so much for being here and for stepping in for Katie. And a lot of us work with Katie, and she is anywhere and everywhere. So understand that she's in a meeting. And now Jessica from TAM Union.
Hi. Okay, let me share screens. So hi, I'm Jessica Colvin. I'm the Wellness Director at Tamalpais Union High School District. I'm also the founder of Swell, Schools Well, which I'll drop in the chat in a minute, which is a new nonprofit to help schools across the Bay Area and the nation develop wellness centers in their schools. I've been working in wellness centers for 20 years, starting in San Francisco Unified for 13 years, and now 7 years in TAM Union. We started with no wellness centers. Now we have one in all 3, and we're starting to develop wellness centers in our 2 alternative schools. We're super excited. And everything I share is open to be shared with you and your sites. I love learning what everyone's doing. People are doing great work. So in our district, okay, a couple things. First of all, let me drop in here my website in case there's something I can do to support your site. Basically, I've been doing this for 20 years. It's been an amazing model for 20 years, and my dream is to share it with others. So I opened up a nonprofit. Okay, so I'm going to share my screen and share with you kind of what we created for students. So we have kind of combined substance use prevention with restorative practices. And okay, so we created this document. Can you all see it? Thumbs up. Okay, cool. We created this document as a training tool for our administration. So when students get caught on campus in possession or under the influence of drugs and alcohol, this is kind of the flow chart of what they go through. So they get mandated education and assessment. So if they get caught using drugs and alcohol, they attend a workshop called Just Say No, KNOW. It's really dynamic. It's a 90-minute workshop, and we have it offered every month for students who are caught on campus. And the students actually really like it. We worked really hard actually with Huckleberry to create this workshop. We also have a workshop for students who get caught on campus or in possession of vaping and tobacco, and that workshop is called Escape the Vape. So it's kind of 2 different tracks. And regardless if you get caught for drugs and alcohol or vaping and tobacco, you get a one-time assessment with wellness or our Huckleberry provider. We have a partnership with Huckleberry, who are our experts in substance use and abuse. What we used to do is we used to have required brief intervention sessions where students who got caught had required 3 to 4 sessions of brief intervention. And it became complicated because students really felt like wellness should be voluntary. So we actually now only require a one-time assessment. And then under voluntary services, you'll see these are things we offer students. So we offer them brief intervention sessions, and we have a lot of staff who are trained to be able to provide the brief intervention sessions. We offer them our Huckleberry Youth Program, substance use and abuse counseling. We have cessation services. We actually have the first ever tobacco and vaping cessation group being offered right now in our district. We can refer kids to youth court, or we can refer them for treatment. And I'm actually working on something with Huckleberry, which I can share with you all, which is kind of it's something we created a couple of years ago, but we're updating it, which is a flow chart of how to get into treatments, different levels and tiers of treatment in Marin County based on your health insurance. So those are some of the voluntary services for students. Then we have resources for parents and caregivers. Along with Huckleberry, we created a program which I highly recommend using called Resilient Families. And we offer it twice a year, although we could offer it many more times because we always have a full group. And this is actually teens and parents come together to talk about drugs and alcohol. And they actually create safety plans by the end of the session. It's a really amazing workshop. We also have a teen wellness film series. 4 times a year, we use the San Rafael Theater and show a teen focused film around mental health or substance use issues. And then we have a panel discussion. We have a bunch of parent ed events every year. We work closely. I'm on the board of the Marin Healthy Youth Partnerships. We work with Mill Valley Aware and Be the Influence. And then any future offense may result in suspension or in other means of corrective action. So that's a little bit about kind of our alternatives to suspension. And then we also have peer resource classes, which are students that we actually train to educate peers about drugs and alcohol. So we go in and train them, and they go out and train their peers. And we do a bunch of different programs. They do a Just Say No workshop themselves for freshmen who are in their health ed class. We do a school-wide campaign called the Game Plan, where students commit to a game plan on how to be safe and choose alternatives and help make healthier decisions. And then this year, next year, we're actually doing something that I'm really excited about, which is an upstander awareness event, where we're actually going to teach young people how to be an upstander in a variety of situations. Everything from substance use and abuse, like when to call police, when do you know that your friend needs an ambulance, how do you make sure your friends aren't walking away with somebody when they're intoxicated and they can't consent, to bullying prevention, to sexual harassment, but we are including drugs and alcohol in this upstander program. So we feel excited about that. The other thing that you see on the web that I'm sharing right now is our virtual counseling and wellness center. We created a virtual counseling and wellness center that also has supports for drugs and alcohol. So you can see kind of all of our different topics. But if you get down here, we have vaping, a whole section about vaping, but we also have drug and alcohol education. And we have a whole flyer that we created about what harm reduction is. We have we did a whole event about WeejaCate, and I'll drop this link in the box so you guys can check it out. But we did a whole event about educating about weed. We have partnered with Natural High. We really like the MTV 16 and Recovering series and Recover Together. And then finally, this is an example of the 16 and Recovering program. And then we also have naloxone in all of our on all of our campuses, and we've created a training to train our staff on how to use naloxone. And then you can see this document. This is what we have up in bathrooms. So prevent an overdose, save a life. TAM schools have naloxone. This is where it is, and this is what you do. So that is a very brief overview. Let me stop sharing. We do lots more. We partner specifically with Huckleberry Youth Programs to be kind of our expert in substance use and abuse. And we offer trainings throughout the year to support our staff and clinicians to make sure that they can address substance use in their individual sessions and groups. Thank you so much. I will drop the our website in here as well. Oh, Nancy, I think you're on mute.
I was thanking you, and then I was just asking, I'm assuming that the schools are connected through the Wellness Collaborative, is that right?
Correct. So there's the
Okay.
Marin Schools Wellness Collaborative, and we all meet together once a month.
That's wonderful. That's wonderful. So you can check. Good, great. So we're going to move on to real lived experience, and Dom, you're still here. I know that you have to leave at 20
Yeah,
after.
I'm
So
here.
we're going to have you go, and then Donna, we're going to have you wrap us up. How about that?
I'll be short and sweet. Because we don't have, unless we all high schoolers. I can tell you a story. I can tell it to you. I can make you laugh. I can make you feel sad. I can tell it to you any way you want to hear it. I've been in recovery. March 5th made 22 years. March 5th made 22 years clean and sober. So I'll just give you a brief overview. I started using drugs at 13, snorting cocaine. Ended up in the Talmadge House. Anybody remember the Talmadge House in Petaluma? It was a drug program for youth. Well, I escaped there. And came back to San Francisco, continued my use. From 13 to 29, I could say I've probably been to every prison in California except 3. I've been homeless, lived in the Tenderloin, took my drug use to Fort Lauderdale, Florida, Prairie View, Texas, Baton Rouge, Louisiana, Wichita, Kansas. I've done the worldwide thing. So I've done all the things actual addicts do. I thought I could go somewhere else and things be better. And, always found where I needed to be. And that was with drugs. Today, my life is, because I know my life experience, you guys, we'd rather give it to the children. We know we've been. Today, I'm the director of medically assisted treatment programs for Marin City Health and Wellness. I work closely with Dr. DeVito, Bobby, Andy, Nancy. I'm a member of RxSafe Marin. I worked in San Francisco for 7 years for DPH. I worked with HIV and Hep C case management, and I also worked with youth in high schools in San Francisco. So I've done a lot of volunteer work with this program, Positive Directions, which is in San Francisco, which is the treatment program I went to. So when I got out of prison, I think I went back to prison January 7th of 1999, and that's the last time I ever used drugs. But I think March 5th, while I was in jail, I still had drugs. So March 5th of 99 was my last actual intake of drugs. And so I got out and went to treatment, and I ended up treatment was for a year, and ended up staying in treatment for 5 years because I was scared to leave. I didn't know what to do when I got out. So I stayed for 5 years, and how I ended up going to college and getting a few degrees was I went to college on accident. I went to college just to get financial aid because the guys were getting all these checks in the treatment program. So I said, well, hey, let me go enroll in school and see if I can get a check at City College. And I think I'm probably one of the only persons with a degree from San Francisco State without a high school education. Because when I went to take my entrance exam, they asked me what high school I went to, and I said San Francisco Renaissance. And I started my GED, but I never completed it. And when they tried to get my records, the school had sealed all the records, so they couldn't find out if I had it or not. So I just rolled with I did it. So I got into college, and first few semesters of college at City College, and I'm a prime member of the Second Chance program, if any of you ever heard of it. It's the curriculum they have for formerly incarcerated people at City College. And then I'm a graduate of Project Rebound from San Francisco State, so with Dr. Bell. So, I ended up going through school first year, it was all bad. My first few semesters, I was an 0 nothing in college. But it's funny how this one teacher who's still my best friend, she's a professor named Cindy Harrison. She teaches at Arizona State now. And one day I was sitting in class and I was still in treatment and I was still boggled. I still didn't know what life wanted to be for me. And she called me to the front of the class. She said, hey, if you allow me to help you, I will. And I think that was the first moment in my life when I trusted somebody. I trusted the lady. Now, this was a Caucasian lady who rolled bulls on the weekends, and she was a lesbian. Now, what do we have in common? I'm from the hood. I go to prison. I smoke crack. Like, how could this lady want to help me? What does she have for me? But I guess I let my guards down and let her friend me. And it was the best thing I ever did in my life. That decision was the best decision I ever made. And that lady taught me how to go to college, taught me how to study, taught me how to write papers. And I would hate to have to write papers in English class because she was an English professor. So can you imagine an English professor grading your papers before you turn them in? I had to keep writing them over and over. No, too many grammatical errors, too much. So, and she opened my life to a lot of different people and a lot of different friends. And, I started shedding off my old friends, my friends in the neighborhood, I even got to think, well, you think you're different now. Yeah, I am different now. I'm doing different things now. I am kind of different. So I accepted that and I rolled with that. And it's funny because when I go back in the San Francisco County Jail with the veterans, they have this veterans program before COVID, I'll go back in, I'll see my same friends that used to say these things to me. And it's like, man, we wish we'd have done what you did. No, well, you chose your path. But I'm grateful that I had people in my life that helped me. And I think my life's mission is working in this field with youth, adults, whoever it is, whoever I can help, because what we resist is always going to persist. If we resist help, it's going to, the things that we're resisting is going to persist. And I always tell people there's a remedy to getting sober and clean. If you do everything you don't want to do, you'll never use drugs again. You have to do the things you don't want to do. And that's the hard part about recovery. People getting used to doing things they don't want to do. And I'm open to help and support our county, our children, our adults, whoever. When Andy and Bobby call on me and say, Don, we need you to do this. I'm on vacation, y'all. I'm really on vacation, but I'm here, and I'm just willing to open up and help. And they all got my number. I love to work with some of the kids you guys got. If it's anything I can do, just let me know. And I really don't got too much to say. I'm grateful to be here. Thank you. And we all we got. That's my logo. We all we got. Thank you. I'll put my information in the box, but I have a crazy 3-year-old next door at preschool. That's the convenience of working next door to your child's school. You just walk right over 5 minutes and get it. So I'll put my email and my cell number in there, and anybody who needs it can reach out to me. We can have further conversation, and I'll let Donna have the flow.
Yeah. Thank you, Dom.
No problem.
Thanks, Dom. That was awesome. Appreciate your
No problem.
vulnerability and
No problem.
sharing.
It's all
So we're going to roll with Donna, who's a parent of a child in treatment or that's been in treatment. Not Dom, but somebody else that was in treatment. So she's going to finish us up here. And thank you, Dom.
Thank you all. I'll see you guys later. I'm going to go get this baby. All right. Bye-bye.
So hi, everybody. Thanks for the invitation to present today. I wrote part of my story thinking that I would be speaking to students, but that's okay. You guys understand that, and maybe if it's represented to somewhere else, it will help. I was asked to tell my story as a Marin parent whose son has lived with an opioid use disorder for 10 years. And I am passionate to help others learn from my experience. Listening to all of you today, I realize how far it has come in terms of the services and providers that are setting up programs. I think a lot of my story today is what it wasn't, but that's okay. So I use the term substance use disorder because it is the medical associated term for this disease. And you'll still see the word addiction spoken of when we're talking about this problem, but it perpetuates a stigma for those struggling with the disease because it suggests that maybe they don't have control over it, and it assigns blame to that individual. My husband and I live in Marin County. We've been here for over 45 years, and we have one son who attended a Marin County high school, was popular, funny, well-spoken, very loyal to his friends, and adored sports and being an athlete. When he was 15, he had a sports injury and was prescribed a month's quantity, this is 10 years ago, of opioids in 2011 by a doctor in a well-known orthopedic clinic. At that time, I had no knowledge of the addiction of opiates or the danger, nor did the doctor in the examination room ever warn us of the possible dangers of the medication. And now it's widely known that an individual, especially a youth, can develop an addiction in about 5 days. And I do remember questioning the doctor in that room, and I said about the quantity and how long he should be taking these. And the doctor said that he could continue their use based on his pain. We all know the story about that now, but that's how it started, a prescribed quantity of pills. That's how it started, a prescribed quantity of pills. The prescription ran out. Although my son wanted more opioids, his primary doctor, whom we took him back to, determined that he should taper off the opioids. But looking back, I now realize that that's obviously when my son figured out that he better source other ways to get the drugs himself. And I don't understand or know about all those. That's still part of his story, but I'm sure, I mean, I know that that happened. His disease was not initially diagnosed, although he was into his disease at this point. And instead, we were referred to a psychiatrist who still didn't diagnose it or tell us about it. And it led to prescriptions for depression and anxiety. It was unclear to us for a couple months, but we started seeing behavior confirming that he was still using opioids. We found pills, we found a pipe, we found aluminum foil, which he used to snort or inhale. They call, follow the dragon. But I don't, at that point, I didn't know the medical explanation described by Dr. DeVito. And that is how the drugs impacted my son's brain and why my son was experiencing the inability to stop using. This is all information that's out there now, but back then it was not available to me. Our family problem was definitely spilling over into interactions with school, friends and parents, doctors, counselors, a little law enforcement checking in, and crisis teams. But really 10 years ago, there was still limited information offered and it wasn't coordinated. The school marginalized him further by forcing him to transfer to independent study, and that was a recipe for disaster. I remember at the school, there was one psychiatrist, and I'm not faulting the school because this is where the budgets were and this is the story 10 years ago. But I remember for the counselor, there was like, she had 300-400 students under her, on her tablet of people she had to work with, and the psychiatrist, there was only, I was told there was only one for about 1,100 students. So there wasn't a lot of time, there was a lot of confusion, and the behaviors weren't identified to everybody, so it was like we were all in a fog. My son's disease really changed his life. It also changed my life. It was very traumatic. I was in shock. I was very fearful. I was horrified relatively soon afterwards to learn how the drug could result in an accidental overdose and how easily that could happen. I was angry. I did not want this disease in my life, and it was big time in my life. I was shamed. I felt isolated. I felt very stigmatized by the community. I knew that the vast majority of parents wanted to avoid us. They definitely judged us. Our son must be a bad person who you should not have your child associate with. And we, this is what I felt, must be bad parents to let this happen. don't let your kids near us and you'll catch the disease. And I wasn't sure where to turn for help during this period. You know, I was doing the internet, I was checking with everybody, but it was very disjointed information. And I felt very broken in spirit. But also, my parental instinct was to protect my son. And so I scratched and clawed. You know, it's not like my son came to me and said, Mom, I have a problem with needing this drug because it makes me feel good. And when I don't use it, I go into detox, and can you help me? That wasn't what my son was going to do. And it was his private story, and he was going to offer it up. And in fact, he didn't want to when I was checking in, because I represented the person that would make him stop. I was powerless to really help with the disease. I know that. He was 50, but he was 15, and he was a kid who wasn't an adult, and he needed some kind of intervention because he didn't want to stop at that moment. I needed others to help me help my son. And that was really hard to find 10 years ago. In all the work and all the presentations that you all offer, I mean, I see that it wouldn't have been hard, but back then it was really hard. I didn't see law enforcement as help to our situation due to what I perceived as the lack of awareness about the disease. I was very fearful of getting law enforcement involved because what that might do to put me into the system and my son. So I stayed clear. I don't remember if I could easily find information on Marin public health. I'm not even sure, as a parent or someone who didn't use a public health system, if I knew that that was an organization that I should turn to. It certainly wasn't presented to me at the high school. I remember the counselor actually slipped me a little note of a counselor she knew about, but it was sort of dark and under the table. I mean, I know that I'm not trying to criticize as much as to say, I think that that's where we all were 10 years ago with youth. Eventually, I found a certified substance use disorder counselor who was able to help me identify ideas for treatments. And at that time, there were no in-resident treatment centers in Marin. There are now, which is great. There were other programs in California, lots of out-of-state programs, troubled teen programs, out-of-state high schools for a multitude of behavioral issues. Trying to navigate all that stuff was horrifying. But in the end, we did choose to send our son away to a youth rehab center in Southern California. He didn't want to go. He was gone for 2.5 months. This was really tough. The impact on his life was devastating, not only because he was separated from his family, but really, I think most importantly, and this is what I want to convey to the people in the school system, is that because he was separated from his friends, it was like that separation of stigma, like he's a non-person anymore. And it severed those connections. I don't think it's ever been really repaired. But upon returning from that rehab after that first period, he spent years relapsing over and over again. I can't even count how many times. Each time, of course, putting himself in harm's way. Looking back 10 years ago, there was not enough coordinated public information as there is today for my family and the community to help better understand compassion about what my son was going through, what my family was going through. It would have really helped. I know it would have really helped back then. It doesn't mean that the addiction, there was still a long journey to it, but it just means that, you know, I'm actually even sort of feeling the trauma right now. We did attend a parents meeting group called Al-Anon for years. And the message was about how to take care of ourselves, because with this disease, the individual has to take care of themselves, the individual being my son. I ended up differing with the concept of using Their tough love advice, which is a big message in that setting. But I feel real different about that. I feel that we can do better with understanding it requires extreme love. So today, it's different. But there are two critical issues that I think should be front and center based on my experience today. One is there needs to be a really push for how in public education on how stigma plays a huge part in seeking help with recovery. My family is still uncomfortable with the bouts of stigma. It still comes up for me, not with all of you, but in a public setting, oh my God. We all need to work harder in helping people find their place in our society and not be branded by their substance use disorder. Secondly, our health system, I know I'm preaching to the choir here, all needs to include mental health as part of the normal wellness examination, and insurance companies should be required to cover the expense. I cannot even begin to tell you the money that went out of my retirement fund for this whole period of 10 years. Not to say poor me, but it's just overwhelming. And think of me, I have, means to figure out how to put that package together. I think of all the people that don't, it's like crazy. Former US Representative Patrick Kennedy has been an activist for mental health parity and addiction equity since 2008. If I'm sure maybe you all know about that, but he has Facebook and a page on that on the internet, and it's good stuff. So what is good? There is a greater public awareness that opioid use, I'm ending here, greater awareness that opioid use is a mental health and physical disorder that has greatly affected youth. I mean, that's out there more. But no matter what awareness there is now, I want to highlight that when this disease hits, it's still a traumatic experience for the family. And I was listening today, I was thinking, we still need to look at this as that being the fact. There might be some thinking that may have to go out as to how we can outreach to the family when something like this happens, because there's so much shame and stigma about it. It's hard to put yourself in the hands of others for support, even though that's the way to get help is the way to get cured or to get help. Or get recovery. There is a greater network of resources and programs in Marin County. I am so happy. Marin Behavioral Health Services in the Public Health Department has resources, support, and is working with multiple community organizations and providers to combat the epidemic. And that's my work. I'm an activist on the RxSafe Marin. There is harm reduction medication available to all without prescription that can be administered to save the lives of individuals who have overdosed, Narcan. There is harm reduction medical assisted treatment to help with opioid addiction. My experience leads me to support the idea that the substance user should not be abandoned or stigmatized by their friends, because that can be harmful. Like, I've got another minute here. Is that okay with everybody, time-wise? Sorry. Often youth friends know about an individual's substance use problems before parents and other adults. Understand that this is a disease that requires professional help. The substance user cannot do it alone. Peers and friends can support with compassion, kindness, and continued friendship, even when that's hard to do, because you can't force the user to do it. See the best in them and be with them, and realize you can't change them. They have to do it themselves. Get educated in overdose prevention with Narcan. Learn more about the facts about, this is an important one. This was very valuable to me, about what detox withdrawal is for the substance user, and to know how difficult it is to think about going into detox for that user when they're trying to get help. Support a youth wellness center at your high school. You guys have all presented information on that. Hold love and hope in your hearts. Never, never, never give up. A friend gave me an uplifting compliment yesterday when I told him I was speaking. He said, Donna, you've been an advocate for fairness, respect, understanding, and support for so many that society has tattooed as negative. This has been my journey of many years. We are a family of survivors. Our son, happy to say, has just celebrated his 4th year of continuous recovery this month after 6 years of struggling with relapses. And I want to point out that he was not able to sustain that recovery until he was finally prescribed Suboxone, which is the medical assisted treatment that is now available. For all his rehab experiences, I'm not sure why it took him and his counselor so long to receive this medication, but it seems like a miracle to us. My son is taking responsibility for his own life in recovery, and I honor that. And life is precious. I am grateful for every day. I'm sorry. That's it.
Donna, thank you so much for sharing that. That was very touching.
It was very
Very
moving.
touching. And I just want to thank Donna for all her work, and RxSafe Marin. We have a few very committed volunteers and members from RxSafe Marin that have very personal experiences with addiction, with substance use disorder, losing a child, or doing what Donna did and standing by her child through years and years of treatment. And that is your pain. It's hard to hear.